We talk about why striae develop, the main risk factors, and how to prevent and treat them effectively. Striae, also known as stretch marks, occur when the skin stretches or shrinks too quickly. Stretch marks most commonly appear when a person grows rapidly during adolescence or pregnancy. They can also occur with fast weight gain or loss and in bodybuilders who develop muscles over a short period. The idea is that the skin is pulled beyond its natural limits. This happens because the proteins collagen and elastin responsible for skin elasticity and flexibility are damaged. When they are damaged, the skin heals with scar tissue, which differs from collagen and elastin. This repair tissue appears as red, purple, or white patches over time. Stretch marks are extremely common. 80% of women experience them during pregnancy, especially in the third trimester, on the abdomen, thighs, or breasts. They are also common in adolescence, appearing on the shoulders in boys and on the thighs and breasts in girls. Some diseases, like Cushing's syndrome, also cause severe stretch marks. The skin has 3 layers. The outer layer is the epidermis, which is what we see as the skin. The dermis is the middle layer where stretch marks develop. The third layer is the subcutaneous layer made of fat and connective tissue. When the collagen and elastin proteins in the middle layer are damaged from physical stretching, the outer layer also becomes thinner. This makes underlying blood vessels more visible, which is why early-stage striae are red or purple. Over time, the damaged collagen and elastin are replaced by fibrous scar tissue. Scar tissue does not need an active blood supply, so the blood vessels shrink. This also reduces blood supply to melanocytes, cells located in the epidermis that produce pigment. As a result, we see white lines above the scar tissue, which we call striae. Striae formation depends on genetics. Some people have more elastic tissue, making their skin more resistant to stretching. High cortisol levels will weaken the skin's elastic fibers and reduce collagen production, increasing the chance of stretch marks. Additionally, sudden growth or stretching makes the skin more prone to tearing. Now let us talk about whether it is possible to determine in advance if a person has an increased risk of striae. Striae are strongly genetic, so if siblings or parents have stretch marks, the risk is higher. Rapid height or weight gain also increases the chance of stretch marks. People whose skin looks thin and with visible veins are more prone to developing them. If the skin slowly recoils or returns to normal after pinching or pulling, it means the skin has reduced elasticity. People with lighter skin generally have more fragile skin, although striae can develop in people of any skin color. Chronic use of corticosteroids like dexamethasone can also cause stretch marks. Additionally, some autoimmune diseases, such as Marfan syndrome and Ehlers-Danlos syndrome, significantly increase the chance of striae. Now let us talk about how to avoid striae. The first recommendation is gradual weight gain or loss. If a person gains more than 1 pound per week, which is around half a kilogram per week, the risk of stretch marks increases significantly. If you have a normal body mass index gaining 15 kilograms, which is around 34 pounds, during pregnancy is generally acceptable. However, if you are overweight or obesity, the recommended weight gain should be much lower, possibly half that amount. Omega-3 fatty acids support skin barrier function and elasticity, which can help reduce the chance of developing striae. Sun protection is also crucial because UV exposure can worsen the appearance of stretch marks by further damaging collagen. Use sunscreen to protect your skin. Effective skin moisturizing can reduce the risk of striae by 40%. Hyaluronic acid creams, lotions, and serums are among the most effective options. These products improve skin hydration and enhance elasticity. The best results are seen with daily use. Eating vitamin C, zinc, and protein-rich foods supports collagen synthesis and reduces the likelihood of stretch marks. Collagen supplements can also help to some extent, though they cannot fully prevent striae. For best results, hydrolyzed collagen peptides are the most effective. Collagen from marine or bovine sources is considered the best option. Collagen intake is generally 2-5 grams per day for 8 to 12 weeks to see results. Higher dosages are also possible. Collagen supplements are considered safe during pregnancy, but it is important to ensure that they don't contain additives that could be harmful during pregnancy. When stretch marks develop, it is impossible to completely eliminate them, but it is possible to improve their appearance. Shilajit, also known as mumio, is sometimes promoted to prevent stretch marks, though the evidence is mixed. Moisturizers containing cocoa butter have vitamin A, and shea butter may help prevent the formation of striae. These ingredients keep the skin well moisturized and reduce the chance of skin cracking. Regular massage with these creams improves circulation and elasticity, which is especially useful during pregnancy. For the first-line treatment, retinoids like tretinoin and retinogels or creams help fade stretch marks early as they stimulate collagen production. Retinoids are more effective when stretch marks are newly developed. However, retinoids must not be used during pregnancy due to their teratogenic effect. The recommended duration for using retinoids is 3 to 6 months for the best results. Another effective supplement is Centella asiatica in the form of creams, gels, or oils, which promotes its collagen production and wound healing. It is particularly effective in reducing the depth and appearance of stretch marks once they have developed. Laser and light therapy are also effective treatments for stretch marks. Several types of lasers are available. Fractional laser therapy creates microinjuries in the skin, triggering the body's natural healing process. Fractional CO2 lasers are effective for deeper, mature striae as they promote collagen remodeling. Another method is pulsed dye laser, which targets pink and red striae by causing blood vessel shrinkage, making the striae become pale. Eczema laser targets all the white stretch marks by promoting melanin production, helping them blend with the surrounding tissues. These lasers are especially useful for hypopigmented or white areas by encouraging melanin production. Intense pulse light therapy is a broader light-based therapy that stimulates collagen production and improves pigmentation. As a general principle, pulsed dye laser is more effective for new striae, while fractional laser therapy and eczema laser are better suited for old striae. For laser treatment, 3 to 6 sessions are usually required, spaced 1 week apart. The effectiveness for new striae is nearly 70%, while for old striae, it shows around 50% improvement. Another treatment option is microneedling with platelet-rich plasma. It stimulates collagen and elastin production. Platelet-rich plasma is drawn from the patient's blood and injected into the skin during or after microneedling. Its effectiveness can be comparable to laser therapy. The genicodermabrasion also offers some benefit. This involves the mechanical exfoliation of the outer skin layer using fine crystals or diamond-tipped tools. It helps stimulate collagen production and is particularly effective for new red stretch marks. 5 to 10 sessions may have a moderate effect, but it's not effective for all stretch marks. After treatments like laser or microneedling, maintaining moisture with hyaluronic acid or ceramide-based cream supports healing. Finally, stretch marks are not classified as a disease. In most cases, they are considered a cosmetic problem.